news as I see it, encouraging you all to be thinking, sharpening your pencils or whatever the equivalent is on the big issues. Then I want to go in some detail to look at Western Europe. And I want to ask the question, what should we do for Christmas? And I think this is a most interesting situation for everybody, but this is part of COVID world discussion. You know, we're not yet fully relaxed into COVID world. We're just trying to feel our way into it. And that's why I thought I'd like to get you to think about Christmas. The third is, what do we say to our friends who are living in the USA? And some of the people here are in the USA, others are close to people in the USA. What is going to happen in the USA over the next 3 to 6 months? I think that will be quite an interesting situation. And number 4 is, to quote the British Prime Minister, do the vaccines represent the cavalry on the hillside who are going to come galloping down and rescue us? Is that what the vaccines are? We've got 3 vaccines about which there's a lot of excitement. 4th one, which is quite important as well, don't neglect it, the Russian one. But is this going to come along and suddenly everything's going to be sorted out? What's it going to be like, the vaccine rollout? Again, if you've got views on that, it'd be great if you could be thinking about it. It means we'll have quite a working session. Latest news, that will be by report. What to do for Christmas in Western Europe. What's going to happen in the US over the next 3 months? And what about the cavalry on the hillside? And you can say, well, David, come on, there's a whole rest of the world as well. I'll squeeze in, don't you worry, and it won't be a squeeze, a global view on this, because actually all of these issues need to be looked at from a global perspective. It's not enough to look at what's happening in Western Europe without seeing it in the context of the rest of the world. It's not good enough what's looking at the US without seeing it in the context of the rest of the world. And when it comes to vaccines, we've got to look at vaccines with a global perspective as well, and not just thinking about X million here or Y million there. It's 7.7 billion. So that's my little effort at structuring. But before we do that, I'd like to, first of all, welcome Chris Shipton, and secondly, invite Tui to give us the little opener that we usually do, and anything else she wants to do. Tui, you have the floor.
Hi everyone, welcome today. I'm going to launch the poll now so we can see what is going on here in our group before we look outside and what's going on with the pandemic. So please, the question 1 you'll see on your screen now is please share where you're joining from. Once you've done that, you can scroll down, select your age range. And then for number 3, please do share with us how you're feeling so we can feel the mood of the room despite being a virtual meeting. I'm going to leave that open and we can come back to the results later in the session. Thank you.
Thank you very much indeed. Wonderful tweet. Just to say, there are people here who don't join very often, but who've joined today. And I am wanting to make sure that several of you do get the chance to say a word or two. I'm going to pick them out now. Very keen to hear from Vicky Doyle. Thank you for being with us again. Very keen to hear from Andre Hoffmann, if you would like. Andre, and very keen for Jean-Luc Poncelet to come in again, if you feel like it. Ad Spikers, very keen for the Nickolls family to engage, and Fawzia Rashid from Aga Khan. But all of you, I just wanted an excuse to actually give a special shout out to Andre without doing it in a way that embarrassed him, because so keen indeed to get your point of view. And now I'm now going to, hello Rob Tari, thank you for being there. I just saw you. Brilliant, very nice. Scott Knox again, and Tracy Vancouver, nice to see you as well. We'll keep checking up for other people who join, and I always like to be able to acknowledge people if I can. Gawaher, thank you. Just been with Uta Klammer on quite a big session just now on what it's going to take to deal with some of the feeding challenges that we're going to face as the pandemic rolls on around the world. So just we've got 59 million people who are reported as having COVID in the world at the moment. The acceleration that I've told you has been happening since October is still there. You know, how is the acceleration as fast as it was at the beginning when it was the last week of October? Not quite sure, but we are still accelerating. You know, the thing I have to keep telling people is that the first big acceleration in April, May, the second big acceleration towards the end of the summer, particularly with the virus picking up in South Asia. And then the third big acceleration really over the last 3-4 weeks. And as we look at it, it's very interesting to see what's been happening around the world. I told you it was picking up in Western Europe. Western Europe was becoming the epicenter. And then what we've seen in Western Europe is that there was a huge amount of transmission after a lot of movement in September. And then the numbers started to really worry national governments. They did restrictions like early closing of restaurants and so on. But that hasn't been enough. So they went back into a second lockdown. The France lockdown, in the view of the French government, has been pretty successful in that their positive cases per day has dropped over the last week. Their percentage positivity rate has also fallen. It's still too high, but it's fallen, which means that the overall level cases in the community is probably reducing. The third thing from the French is that they have a lower admission to infectious care, intensive care. It's just the death numbers are going up still, but you expect that. Remember, deaths follow cases by about 3 weeks. So once again, it's been shown, as if we needed to show it, that if you really get stuck and you need to reduce transmission, you do a lockdown. But I keep saying to everybody, a lockdown, it's the last resort. It really is not to be used as the principal means for controlling this virus. And we could avoid lockdowns if we were able to put in place really strong societal defenses, locally integrated responses with incident response teams informed by data, much better flexible testing so that you can quickly pick up spikes and surges at the local level, and then a lot of effort into building trust with people so that there is widespread use of physical distancing, masking, all-round hygiene, self-isolation when sick, and protecting the vulnerable. It's not difficult, but it's still not being done satisfactorily in Europe. So we are still in Europe doing this yo-yo from quite widespread movement with some restrictions into extreme lockdown and back again. And that is not the way to deal with this. And we've seen from East Asia, you can do it differently. You can do it by building the defenses into society and holding the virus at bay. And why Western European countries can't do that remains very hard for me to explain. I tried at the end of last week in what I thought was quite modest interview with a Swiss newspaper to explain that there is a way of avoiding this lockdown option. There is a way of avoiding widespread infection like we have in Western Switzerland right now. And I made it clear that it's putting in place the defenses that we've talked about here many times over. But I keep wondering how to get the message across. Over the last 3 days, I've done about 10 different interviews with media around the world. And the trigger for getting those interviews was me saying, is Europe going to go into a third lockdown early next year? And that certainly seemed to get quite a lot of minds focused. I mean, I do think European leaders just dread the idea of telling their public there is going to be yet another lockdown in a few weeks' time, because publics are fed up with this very pernicious damage to livelihoods that comes from lockdown. They're fed up with the weakening of social structure that comes from this approach to governance. And I think a third lockdown will be extremely bad for the social contract in Europe. But I think it's probably going to happen. So the question to all of you and to everybody I talk to is, who is going to prevail upon European leaders to put in place the basic level of local defense plus the trusting relationships with populations that will be necessary to avoid a third lockdown in probably the first 6 weeks of next year, possibly sooner. And I can't quite find many people who talk to me about it. And yet, in Britain, they're talking about ending the current lockdown around the 2nd of December. But 18,000 reported cases a day in Europe. It's been flat. And so you're going to start widespread movement again with that level of virus around in community. I mean, it will lead to a huge surge in cases. It'll probably come really fast, especially, let's say we get widespread movement in Britain during 3 weeks of December, leading up to the new year. It's going to lead to an enormous surge in cases in January. I don't get it. And the same is being planned for Switzerland. I don't get it. France will have the announcement, President Macron and the Prime Minister tonight. Their numbers are a bit lower, but they're not down at zero. There is still a lot of virus around in France. And so you decide that because of Christmas, you're going to let the people move, let the restaurants open. You've got this absolute imperative to do it because restaurants are going out of business, terrible rate. Okay, I'm nervous about it. I'm nervous about doing that without at the same time creating the kind of honeycomb network that we've talked about, which is necessary to make sure that there is proper surveillance of population health. The public health capacity is not in place yet in France. So I'm really, really nervous about what's happening in Europe. And I'm talking like this with a slight edge to my voice, because I've been doing every single media moment I can to draw attention to the need to absolutely put in place public health defenses and get them right. Let's see. I'm not convinced that governing means telling people that they can have fun over Christmas, if that means that they're going to get a surge in disease in January, late January and early February. I just don't get it. And some people are saying to me, well, it doesn't matter anyway, because vaccines are going to come on board early next year, especially following the very good results with the AstraZeneca Oxford vaccine. But also there's the Pfizer BioNTech vaccine and there's the Moderna vaccine. Oh, pretty good results. But I want to be clear, having just listened to Seth Berkley of Gavi, the Global Alliance on Vaccines and Immunization, and having talked to some of the vaccine people in WHO, it's not going to be a magic, instantaneous, yesterday no vaccine, today vaccine type conversion. We're talking about enormous logistical challenges, huge pushback from anti-vaxxers, 25 to 30%. I mean, that's a lot of adults not wanting vaccine. We're talking about a process that's going to take many months. Just simply saying, well, vaccinate the at-risk people, it's fine as a strategy to protect individuals, but that's not going to be enough to really dent this pandemic, not in my judgment. So I am working also really hard, and it makes me sound like a total killjoy to say vaccines aren't going to suddenly convert us into a situation where we can somehow, inverted commas, go back to living like before. I don't think that's it. So I've got concerns about Western Europe, the fact that the necessary defenses aren't being put in place, and there is this move to, inverted commas, open up economies at Christmas. I think that the Brits have been quite careful. They're talking about severe restrictions and so on for when the lockdown is ended. So I suspect it'll be tough, but still, you know, unless you actually can level with people as a prime minister and say, actually, everybody, there is still a lot of danger from this virus. It's a very dangerous virus. It's causing long COVID in somewhere between 3 and 5% of people, and that long COVID is debilitating and horrible. And unless you can level with people on that and say, look, actually, there is a reason for taking it very easy over Christmas this year. There is a reason for being careful. It'll be different next year, and that's true. But this year, let's be careful. Why not do that? Why not have the courage as a leader to just say it straight to people like it is? Anyway, that's my Western Europe and Christmas story. Let's go to the US. My correspondents in the US are telling me of a really horrendous situation in many states. Now, why might that be the case? Do you remember I've said many times before that the issue with this disease is to try to stop the virus spreading widely across societies, to basically hold it at bay, to prevent it from spreading by incredibly rapid, robust, rigorous action when you've got a small number of cases. It doesn't necessarily mean putting the whole place into complete movement restrictions, but where you've got the cases, you restrict movement. Where you've got the cases, you isolate. Where you've got the cases, you do really good contact tracing, or if you've got a lot of cases, really good cluster mapping. But you isolate, and you isolate well, because that's how you get rid of the virus. People either get well in the majority of cases, or they get ill and succumb, very, very few cases, perhaps 1%. It's a very neat way of dealing with this, is the isolation technique. It's different from lockdown. Lockdown freezes the virus in place. Isolation gets rid of the virus. Basically, the virus has got nobody to pass itself on to, and so it's just gone. I mean, that's the way you deal with viral diseases, through isolation. It's been done for decades, for centuries. So I'm saying to everybody, we absolutely have to put in place these basic steps of being able to interrupt transmission early. And if you don't do it and you end up in the kind of half-hearted approach that's in the United States, your virus goes everywhere. And each individual person can start another outbreak. Not everybody does, perhaps 1 in 5 or even less. But there's enough people around to start more outbreaks. It is inevitable that in the United States, where there is inconsistency in terms of response and a very ineffective capacity for isolating people when they've got the disease in much of the country, this virus is going to go on spreading. Thank goodness there is now a pathway to the regime change. Thank goodness, I'll say it, that the new regime, Chief of Staff is Ron Klain. I know him super well. I know him well. He knows about dealing with infectious disease. I hope they keep on Deborah Birx, who's been an absolutely extraordinarily good person in all this. Be nice if Tony Fauci is allowed to keep working, though he's probably wanting a rest. But it's so important. You see, it's 50-something days, 56 days or something, till the handover of power, assuming that happens on time. There's an awful lot of suffering that can happen in the United States between now and then. And we know who's going to get hit the worst. It's going to be poor people, not rich people, not people in my sort of income bracket. It's going to be poor people, non-Caucasian people in Michigan or in Texas or in other states where we know that transmission is high and where we've seen that non-Caucasian people are more likely to get it, and when they get it, may be less likely to be able to access medical care, certainly some of the fancy new medications that are there. I worry for the United States. I worry for other countries where there is just no serious effort to hold this virus at bay. So that's Mexico, it's Brazil. And you see, what we've seen in the European return is the ferocity with which the virus comes back. I don't like talking about waves, yet it is a bit of a wave what's happening in Europe, and it's been ferocious. And we've only managed to slow it down by widespread movement restrictions in Europe over the past weeks. One of my colleagues, Mike Osterholm, who's also on the Biden task force, is telling me, in his judgment, the US is going to have a long and complete movement restriction to deal with this. And perhaps the conclusion will be that politically it's just impossible because of the state governors who just refuse to follow a central line. And perhaps we're going to end up with a really big mess where the effort will be to use vaccine and vaccination to try to control things in the US and to rush out the vaccination. That will be immensely complex, coping with the epidemiology of a part vaccinated population. It's not, I don't think it's the right way to do it. If I had any influence over the new regime, I would say, do try to get your numbers down. Use the containment approach that we tend to use normally to suppress through isolation. And then as your numbers come down, then consider immunization as your primary means of control. But I've got a really uncomfortable feeling about what might happen if immunization is used as the primary control approach in a US where you've got overloaded hospitals in quite large parts of the country. So I'm nervous about the US situation, and I'm nervous about it over the next 3 to 6 months. I just have to say, Chris, we have to look at the diagram quite carefully because I'm talking a bit without restraint today, but I'm expressing to you just an analysis based on an understanding of the way in which this virus moves, an analysis based on an awareness that lockdown can stop transmission, but when you release the lockdown, the transmission picks up sometimes very quickly. And an understanding that the social contract between people and governments is strained in many different settings, and the governments are finding it super hard to govern right now. So those are my points of report. I know you will have many, many things you want to raise. It's about 25. Some of these are going to be quite tricky questions. I do want to say that if Henk Beckerdam had joined us today, he was going to raise the point that very wide scale testing of the kind that's being done in China, kind that's being done in Liverpool, UK, and the kind that's being looked at for some other conurbations is a really useful way to get a handle on what's happening because of the number of people with asymptomatic COVID. And I think that people are going to say, is mass testing the direction we ought to go in? Well, first of all, what are the tests being used? It's not useful to do mass antibody testing. Antibody testing is useful for telling you who's been exposed to the virus, but it's not useful for telling you where the virus is now. So what else have we got as quick and relatively inexpensive tests. Answer the new generation of what's called antigen tests. They pick up bits of the virus. They're lateral flow, which means that you can use it with a bit of fluid flowing across a surface that's got binding molecules on it that bind onto bits of the virus. And as they bind, they usually change color. So you've got these colorimetric antigen tests coming available. One's available from Abbott, for example. It's a development of a test they did for HIV. And it's a good test, but it's got quite a high false negative rate, i.e. you miss cases. Now the question is that too bad, or should you still do mass antigen testing? After all, that's what the White House has been using. They did mass antigen testing, rapid antigen testing for visitors to White House events. It's what a number of universities are using in the US and in Europe. It's what's being considered for air travel. And perhaps I think it's being introduced. It's not whole virus testing, it's bits of virus testing, which is why there's some questions about it. But it may be that if rapid testing is available in very large amount, then it becomes a feasible approach to helping populations have a pretty good idea of where the virus is. And if you do it at intervals, it gives you a way of helping healthcare staff to know whether they've got the disease, people working in residential care to know where they've got the disease, people working in meat factories, another virus trap, to know whether they've got the disease. So it may be a useful strategy, but are we going to be able to offer this kind of testing in the amount that is necessary for a country like the United States or a region like Western Europe, necessary for everybody to know what's happening? We're talking about millions of tests a day. We're talking about an awful lot of tests for this frequent rapid testing. But it's an approach that's been talked about from Harvard. It's an approach that's being talked about a lot in China, and it's being used. It's been the approach that I understand the UK government are working on, moonshot they call it. And it's certainly not out of this world. I would prefer that it was a rapid test for the virus, not for the bits of virus that the antigen testing are. And I'm still waiting with quite undisguised impatience for rapid whole virus testing to come on stream. I know a couple of people working on it, and I think they are having that struggle that one tends to have when you're trying to invent something that you know is inventable, and you're trying to do it against a terrible deadline, and things just don't work like you want them to work, either in your lab or when you're developing your prototypes. But I think that it's not an unreasonable thing. The only problem is that it is expensive. You're still talking about a certain number of dollars per test. And as I say, I think you are going to need, or we are going to need, hundreds of thousands in local authorities, millions in terms of whole countries, of test kits a day. It's going to be quite an adventure. But it may be that that's where we've got to go. If everybody is saying that just doing what the normal basic infectious disease control type public health, like what we did for Ebola, like what we've done for other communicable diseases, like what's happening in East Asia for COVID, if people are saying that's just too difficult to do in Western Europe and the US, then we need to come out with something alternative. But I keep wishing that we could actually indicate to people what it is we talk about when we're focusing on interrupting transmission, what it is we talk about when we mean cluster busting, what it is we talk about when we explain that if we can move from 60% to 90% compliance with physical distancing and mask wearing, we will reduce transmission. I'm just stuck that I'm still not able to get that across. And it's the same for colleagues in WHO, the infectious disease colleagues. It's the same for Dr. Fauci et al. In the US. that we've just not managed to get it across. So let's see. So that was Jonathan. Jonathan, is that okay? You've got a little bit of an answer there. I'm very happy if you want to, if you come back at me and say you would like to ask some more, I will invite you to unmute yourself and just to talk a little bit. Jonathan, I don't know where you're joining from. You look like you might be in some medical practice setting. There's a few things around you that look like that. So welcome to Jonathan Fitzsimon.
Thank you, David. I really appreciate your answer there. Yeah, I'm in my my clinic today. I'm a family doctor, but I also run a COVID assessment centre, a virtual assessment centre in Ontario, Canada. So I'm concerned that even in Canada and certainly in the US, that the test, trace, isolate policy has collapsed.
Yeah.
And we are essentially not effectively contact tracing anymore, because it takes so long to test, to get a result back, and we're just not testing enough people. Simply testing symptomatic people is no longer enough. And so I was very interested to read Michael Mina's article and this sort of suggestion that mass testing with rapid antigen testing might be the way forward. Obviously, the results from Slovakia recently about their experience, different, smaller population, but still there. Concerned to hear about a report from Liverpool mass testing today that some of the poorer areas in Liverpool have as little as a 4% pickup on their so-called mass testing going on there. Once again, the poorest members of the community not sort of accessing the whole process.
Yeah.
So I too share your sort of intrigue, I guess, about whether rapid antigen testing can work. I think we have to accept that currently the test, trace, and isolate system in North America is not working, and I agree that waiting until this time next year until most people have had a vaccination is just not an option.
Yeah.
Thank you.
And why, in your great country, has it proved to be so difficult to put in place a process of high suspicion, then disease confirmation, then isolation of cases, then tracing of contacts, or at least analysis of clusters, and then isolation? Why is it proved so difficult?
The simple answer is mixed messaging. So we went from everybody get tested, go and get a test, everyone, when the system was not in place. And so the testing system got overwhelmed. People spent the entire day in a lineup to get tested and were then sent home at the end of the day. Right. Then the labs got overwhelmed. So it took 10, 12, 14 days to get your results back. Irrelevant. People lost faith in the system. Then we went to, okay, just if you've got symptoms, if you've got a number of symptoms, only you can get tested. Right. And then we realized, well, that's just not good enough. And then the kids went back to school and we said, okay, every kid with symptoms get tested. Every kid got symptoms because they went back to school, and the system collapsed again. So this mixed messaging of who should get tested has reduced confidence. It's reduced our ability to turn around the tests quickly. And so effectively our contact tracing is not functioning.
So I think that there is a real case for saying that if countries shift from PCR testing, which always seems to get stuck at a particular point, when you build up in demand, the system collapses, and collapses rather quickly in countries that have got little capacity, and it collapses slower in countries with a lot of capacity, and it hasn't collapsed in South Korea because they have enormous capacity. But it just seems to me that if people are going to shift to antigen testing, at least try to get the test, trace, isolate scheme working, and try to get it working at local level. Because for me, still, that is the mainstay. I don't know. I think just going to mass testing, I'm not quite sure what that's then going to lead to. But
well, my hope is that the mass testing would help the isolate. So you wouldn't need to do the contact tracing if everybody is testing once a week, twice a week, because then you allow people to find out for themselves if they are infected, and then they isolate until they're no longer infectious.
Well, Okay, everybody, there you are. I mean, I am just, the reason why I don't think this mass testing is going to do global is it is not going to apply in poor countries. There will not be the resources available to buy. So I don't think we've yet, Jonathan, you may disagree with me, we've not yet found a solution that will really work in, for example, Nepal, where I've got several people now writing to me from Nepal saying they are stuck on strategy, just don't know which way to turn. Their test, trace, isolate is overwhelmed. They are finding it very hard to get their isolation to work, and they're not going to go into any kind of lockdown because it totally massively multiplies poverty. And there is a sort of slight sense, well, we just have to let the virus go. And that may be what has to happen in resource poor settings. But I want you all, while we're talking, to be not scared of sharing ideas for what might be necessary in resource poor settings, but looking ahead to the time when quicker testing becomes more widespread and when also perhaps we may have other options, but it'll be some time before the vaccines are here, and therefore we are going to need to be strategic in the meantime. Jonathan, thank you. I hope you can stay on, and I hope you'll dive in. Don't hold back, unmute yourself and dive in if there are more things you want to say. These are very, as you probably gathered, I tried to get them fairly open conversations. Thank you, Jonathan. I just want to say there's a standing invitation to Andre to just burst in whenever you like. But at the same time, you might have other things on your mind, so I don't want, but if you just unmute, I will see, because I'm watching you very carefully from, oh, here you come.
So David,
yeah.
I mean, I just want to congratulate you for providing this island of sanity into the crazy world in which we live. We keep on being bombarded with theories left, right, and center, and nobody's actually facing the facts. Yes, mass testing might be a solution, especially of using antigen tests, but these are humongous logistic issues which are going to be difficult to multiply in all countries in the world. Yes, again, the rich north will be able to do some of this testing, but that will not be enough, and we all know that. So having said that, the fact that the vaccines have come, the fact that we now have 4 vaccines with efficacy more than 90%, that is fantastic good news. And it's something that really I did not expect to happen so early in the game. Okay, the fact that they exist does not mean that they're going to be widely available. And that's, of course, the next challenge. But I applaud you for holding these seminars. They really are very useful.
Andre, thank you very much indeed. Andre is somebody who's very active in the whole area of therapeutics and vaccinology, and indeed also testing, as well as many other things he does in life. So it's a real pleasure to have you with us, and thank you for what you've said. Andre is also, like me, living in Switzerland, in the western part of Switzerland, where we really are experiencing extremely high levels of transmission and some quite interesting policies. So I think you are so welcome. Thank you indeed for being with us. I'd like to go to Bob Stallman. I think, Bob, it'd be good if you don't mind telling us where you are. We think you know where you are. It's lovely to be joined by you. And you want to talk a little bit about vaccine and vaccine policy through a US lens. Bob, if you're hearing me, could you unmute now? I can't see you on my thing. Yes, there you are. Bob, are you able to unmute? Would you like to? No microphone. Okay, so this is what Bob says. Bob, I think you're from University of Texas. You're in Houston. If that's right, then that's good. If it's wrong, you will excuse us. You're saying, in the US, we've got to remember, we've got various communities of people who are going to be hesitant about vaccination. First of all, he says, are the anti-vaxxers, of which there are many. Truth. Also, there's hesitancy among pro-vax people because of the way in which Operation Warp Speed was conceived and then named. He says the very name suggests rushed and careless process. That's the word careless in its absolute sense of without care. He says the Food and Drug Administration is being super careful, and the vaccine will be safe, at least given the data that are available through the phase 3 trials, when the FDA eventually pronounces on particularly Moderna, but also some of the other vaccines. Remember, each vaccine has to be given an emergency use authorization by the national authority in the country where it's being used, unless the country decides to accept the emergency use authorization from another country, or unless the WHO has done a process on behalf of all, which usually takes a bit of time. So he's saying FDA is being careful, the vaccine will be safe, but he says the perception is affected by the messaging which prioritized speed, perhaps at the expense of safety. Indeed, the speed message was accompanied by language about cutting corners, cutting red tape. And those of us who've worked on vaccines and particularly been involved in these trials, but especially the phase 3 trial, which is the important one, we know that there are no corners to be cut. That's the whole point. And so that's been something that many of us have been fretting about. Usually you run a phase 3 trial for longer than is needed to show that the vaccine is effective. And that's because you build into the phase 3 trial a period of several months after the administration of the vaccine, beyond the period when you need to show that the vaccine works, in order to see whether there are any adverse effects. I mean, it goes without saying, there is always a possibility that if a person who's been vaccinated is then challenged with virus, that there might be an adverse reaction. Remember, these diseases are not just about a virus attacking the body, they're about the virus attacking the body and the body fighting back. And you get sometimes this gigantic struggle with something called a cytokine storm happening in the middle. It's like a giant blizzard of white cells. And that can be a very bad thing for people. And it can lead to all sorts of nasty effects. And so it's right that we do a bit longer observation on safety in phase 3 trials, even when you're doing an emergency use authorization. So I actually do think Bob Storman is absolutely right, that there's been some clumsy communication around Operation Warp Speed. No, we're not served by people who are gung-ho about the vaccines are fine, the vaccines are fine. Anybody who criticizes the safety of the vaccine has got something wrong in their head. No. And so thank you for pointing out there are two groups. There are the anti-vaxxers and there are the vaccine hesitancy community, the ones who are just not sure, scratching their heads, and that's all right. And that's one of the reasons why I'm saying that in the vaccination rollout, you need to be offering second and third chances to people. Some people will say no the first time round. And they'll want to watch and see what happens to others in their families or friends. That's legit, that's okay. And so you need to be able to give people second and third chances. I think that's so important. And it's something in my little bits of advice this last week, I've been saying that matters. So I wanted to check others who might like to make comments. If Ad Spikers, Jean-Luc Poncelet, Vicky Doyle, anybody else who normally talks wants to make a comment, please do. I'd love to hear from Gawaher in Quebec. So Gawaher, if you've got good internet and your microphone works and you feel like speaking, could you talk to us about what you are seeing? And I've been talking to the Canadian Health Minister, I really like, Patty Haiju. And I think these are challenging times, and also there's quite a lot of provincial politics going on in Canada, and it must be quite tricky in that context. Over to you.
Thank you, David, and greetings to everybody. It's lovely to be with all of you. Yes, I mean, I'm deeply concerned about what's happening here. We have provincial governments that sort of move in their own path and take their own decisions. In Quebec, for example, we've ignored the steady 1,000 a day numbers. And we're a small country. We don't have the huge numbers of the US, but per capita, it's getting quite high in a number of our provinces. And Quebec just hasn't budged from an average of about 1,000 a day in the last couple of months since we had this semi-lockdown declared early October. And a few days back, our provincial government, as some of my Canadian colleagues here around the table know, decided to just ignore the coming weeks and declare Christmas holidays as a 4-day event, 10 days per household. So obviously, people who are fed up and sadly just wanting to live and ignoring the consequences will be meeting with 10 different people a day, at least. And so that is problematic. And the federal government, I agree with you, is very sharp. The Prime Minister spoke a few days back asking people to limit their contacts without declaring a lockdown. But it seems to me that we will need to have a serious message from the government and declaring what we're going to do in the coming weeks, because 4 days is going to be calamitous here. I don't know what the other provinces will do, but we need one message and one approach that is Canadian to keep this from going in. And that's my personal opinion.
Thank you. Well, there's hot debate in the newspapers in where you are, Gawaher, about this, because it's clearly it's this effort to create a window so that people can have fun, but it'll be a pretty dangerous window, I think. So thank you for sharing. I hold on to this and think about it. Let's go to a different part of the world. Let's go to Joe Nickolls. Joe's asking a question that's a bit technical, but it's very important. But it might, if I invite Joe to speak, it might be that she will talk a little bit about how things look from where she is in East Africa, with a bit of a view of Kenya, but also looking eastwards towards Somalia and perhaps other parts of the region. Joe, please.
Thank you, David. I mean, the numbers in Kenya are consistently sort of 1,500 a day, but the percentage positivity rate has been at 15% or over for probably about a month. I mean, it's been really quite high for quite a while, and hospitals are getting full. And WHO is reporting that both the numbers are going up, obviously, but also the severity of illness seems to be increasing as well. And healthcare workers are quite badly affected. In Somalia, the official numbers are still relatively low. But there have been quite a few cases, in the small community that I'm concentrating on, of misidentified dengue fever or malaria, which then turn out to be COVID-19.
Wow.
The question I was asking was related to a discussion we've been having about how long quarantine should be for, and also about the potential transmission from asymptomatic people. So it was, if you can still become COVID positive up to 14 days after exposure, then we know that if you get sick, there's a period where you would then be infectious. But what about if you don't get sick and you're asymptomatic? Could you still have the 14-day period, turn positive, but then be infectious in some way, but not showing symptoms for a further 7 or 10 days? So what would be this sort of safe time after being exposed to circulate fully in a community, and especially in an enclosed community?
That is an impossibly difficult question. it sort of reminds me of one of these logic puzzles that you get in comics sometimes. And the reason is we don't know, us people who read these papers about this thing, don't know enough about the infectivity of these asymptomatic people. Is somebody who has no symptoms yet is carrying virus as infectious to others as somebody who has symptoms and is carrying virus? If we work on the assumption that they are infectious, then as far as I can tell, your point is well made, and any effort to shorten the period of quarantine for somebody who has somebody who's been exposed, I think you're showing that these shortened quarantine periods are very dangerous. So I am one of these people who cannot understand why there are countries that are deliberately trying to reduce the quarantine period down to 7 days or even less, because I think that's very, very dangerous. And I think there will always be some people who are infectious for quite a long time because of this asymptomaticity. So I don't know the answer to your question, because I am not able to tell you how infectious asymptomatic people are. I was trying to work out, in your logic, are you assuming that the asymptomatics are as infectious as the symptomatics or not?
No, I mean, I was assuming that there is a statistical reduction over time, whether it's because people who turn positive are likely to have returned positive in the first 7 days, and also presumably because people who are sicker tend to have a higher viral load, but this isn't based on sort of a strong medical understanding, but just, you know, the risk would perhaps diminish, but not disappear completely.
So I think you're right indeed to make this calculation. Everybody else, though, I want to stress to you why this is important. There are data from a number of African settings which are suggesting a higher level of asymptomatic COVID infection in the community, i.e. people with COVID but no symptoms at all. The higher level of asymptomatic infection in African communities than in some European communities. I mean, my own just statement to all of you is that I truly do not know what the level of asymptomatic COVID infection is in different settings. In one large study, which involved our group in Imperial College, called the REACT study in London, it was around 10%. You know, we're not dealing with large numbers of people who have antibodies but do not recall having had any symptoms of COVID. But then in studies in boats like the Diamond Princess are moored off Japan, over time, the level of asymptomatic really rose. In some Indian studies, there's a very high level of asymptomatic COVID. And in Africa, in Nairobi, Jo herself has told me about some studies suggesting very high levels of asymptomatic COVID. So that's why your work is so important. I think trying to unravel what happens with people who have COVID without symptoms is key to really getting on top of this and trying to explain the patterns of the epidemiology. I also believe that it is this asymptomatic COVID that makes it so hard sometimes to understand the dynamics of infection. I haven't necessarily answered your questions, Jo, but I'm basically saying I think that it does mean that you need to be quite careful after exposure, especially given the levels of asymptomatic spread. I don't want to come into conflict with any guidance you get from the government, but I am super wary about these efforts to shorten the quarantine period, again done to try to get people back to work quickly, because that can be difficult. Karyncaplan is here, and Karen, I'm not quite sure what time it is where you are. I think this is your time of day when you are with us and it's not the middle of the night. I'm looking there. It looks like you're in sunlight or daylight anyway. Karen, where are you and how is life?
I'm feeling a bit, well, not a bit, a lot more positive now that we have a regime change. An ascertainment that finally happened yesterday. A
Right.
ridiculous concept, absurd. But I would like to say some positive things before I say some negative things. I'm very positive about what's happening with the campaign this week in Africa, about Africa Mask Week, especially given that the numbers are on the rise in this past month. And what Joe was just saying, that healthcare workers, especially in Kenya, have really taken the brunt. They've had quite a number of physicians die.
Yeah, that
Absolutely tragic.
terrible statistic that Joe shared with me.
Yeah,
Thanks
so
for bringing it up.
yeah, I said I was going to say something positive, but I guess the positive part is there are these 70 plus organizations across the continent that are really trying to get the message out, and Rockefeller Money and a bunch of others will financially sustain this campaign going forward, and it will get bigger over the next couple of years. So I think that that's one positive thing to say, besides regime change and the fabulous people on the COVID panel and incoming. I think is also a good positive to mention. The two quick negative things, or three things. In New York, where I am, well, East Coast, there's a line this week for 5-6 hours to get a test. And the reason for that, usually it's been about hour and a half. The reason why it's so high is because people are going to go to these massive holiday gatherings. They've just decided that whether it is absolute fatigue or they're just going to go, maybe they don't believe it's a hoax. Maybe they don't believe that, they're not anti-vaxxers. Too many people, though, have decided they're going to take the vaccine because they think it's just going to immediately get rid of it in the community. They have no idea how long this is going to take, all the distribution, the logistics, what actually this means. Will we have to get multiple vaccines year after year? The messaging still is just such a disaster. America is a disaster. And I feel like the disaster that came from this country has spread around the globe, and it is a disaster that we have to own fully. I worry about some other things that are happening, and that's just new from talk about who's been leading Operation Warp Speed. We had some very good positive stories about immigration and immigrants leading this movement of research and innovation, which is a positive news story to have happened finally about immigration in this country. And then immediately the backlash was the lead scientist on Warp Speed happens to own, $12 million of stock in a company that's, making money or about to make a lot of money from the vaccine. There's just this back and forth. We're just in the current yo-yo here, which I know will end, but I want to just say one thing. I was really hoping that there would be more of a discussion about universal health coverage, and this being the opening of the door, because I'm a huge believer in UHC. I helped former president of Tanzania, Kikwete, launch a UHC campaign in 2018 for the continent. We just don't hear enough about UHC, and I really think that this, and PHC for UHC, and really getting this is a window of opportunity.
Okay.
And because I believe in all things systems interrelated, I could talk about food and sanitation, but I'll leave something on sanitation for just a second, which is I'm seeing insane waste. I've been between DC and New York City a lot. And the number of masks and plastic bottles on the ground of sanitizer and wipes and grotesque, just this stuff, these plastic bags are being used again, where we'd finally phased them out, at least out of New York City. Anyway, that's positive, negatives. I really love this community and learning from all of you, so I'll stop talking.
Karen,
Yeah.
one really important thing I think we all have to learn not to feel guilt, because the leaders of the countries in which we live or of which we are citizens behave in a way that we find hard to explain. I kind of sensed in that in your conversation. If I, on behalf of everybody, can say we thank you for being part of this community, and we take you as Karen and not as anything else. It's so important, so important. Rebecca was writing in, and I thought to say to both of you, I'm saying it to every American I know. Now, just the regulation 6 feet away from me is Catherine Deland, who has been periodically telling me how she feels about all this stuff. We rejoice with you at the capacity of the people of your country to do absolutely great things. And we are with you. We are with you so, so strongly. And it must have been a most bizarre moment the last 3 weeks. Thank you.
Yeah, indeed.
From
Thank you.
I spoke across you. Sorry for that. And nice of Karen to remind us that this, it's a time to really focus on equity, on the importance of universal health coverage. Look, we haven't heard from 1 or 2 other people who wrote, so let me just give a special mention to NK SETI saying, as Western Europe has systems in place to pick up cases and do contact tracing, no. And that's part of the problem, and that I want to see those things better in place, because otherwise you just swing into restrictions. NK, you've got the point. Annie Feltham, comment from a UK MP. Oliver Cromwell's the last person who tried to tell us what to do at Christmas, and that didn't end well. Yeah, there's this phenomenon in the UK of what's called the libertarian right. It's not just there, it's other places. Annie says that part of our political culture explains why we're not like East Asia. Very important point, and one worth holding on to from a political analysis point of view. And Robert Tyree says, what's the good source of info to counteract the false news that COVID-19 is a case-demic? And now this is a group that is telling us there are a lot of false positives in rapid PCR. And this is part of the group that's also saying it's a hoax. Robert, I don't know. I mean, all I do is I get people to look at what's happening in hospitals. But then they say these are faked pictures. And then I just don't know where to go with some of the conspirationists, but we have to keep going. And thank you, Rob, for your work. And Loy Rago wrote on lessons learned or thinking around lockdowns during Diwali in Egypt, and also in Ramazan, Eid, and Prophet Muhammad's birthday. Loy, I can't talk to you this time, but I'm going to ask you next time. And Iman Ahmed says, on lockdown, small businesses are hurting, and she's very concerned about that. I want everybody to look at that. Can we now go to Twee, and then from Twee to Chris Shipton, and then unfortunately, yet again, we have to stop. I love it. I love it. I love the fact that this just goes on, and I want the conversation not to stop, because you are, at least as far as I'm concerned, the best people around. You are the kernel of the leadership that will emerge, and I thank you for that. But Twee and Chris, in whichever order you want, Twee.
Sure. I must have had a bug on my computer, because just as you were handing over to me, I lost the information from the poll, and I must apologize to everyone. But from what I could see, we had a good spread across the age range, and not too many people feeling negative. And what I will say, though, is we don't often have many people joining from South Asia or Central Asia and Middle East, North Africa, and Latin America and Caribbean. So we enjoy this forum with you, and we hear that you love it too. So if you've got people you want to invite, please do share it, in particular in other regions, so we can reach more different parts of the world. That's what I have to say. And I will share the screen of Chris now.
Very much, Twee. So Chris, we think you're the greatest. Got so many from your latest ones, and here you've done it with lovely, clever art. A couple of comments from you, Chris.
David, you've been on fire this evening. Feel the passion. It's very inspirational, and I think, every time I sit down and think about it, I think it all comes down to leadership, really. you know, and I think we hope for political leadership, but I think you're definitely giving us some in this forum and setting. So thank you.
And nice to be Chris, and we really appreciate you. Does anyone want to just, does anyone from our team wish to make a couple of remarks before we close? I'm just gonna, because the team are just so brilliant. I just say, John Atkinson.
Just quickly, I picked up another comment from Joe in the chat saying, hearing stories of people not identifying their contacts, all anecdotal, so that they didn't put their friends out of work. And it tallied with something, this was in Nairobi, and it tallied with something that I was hearing as the cases and data grew around Stoke in England. And I was speaking to some people locally there, and they're saying, well, people are just turning the app off so they don't get notifications, and then they're not isolating. And I think understanding this, understanding people's drives and motivations in this, and often they're trying to look after people or themselves, is really important, because you can design test and trace systems, you can design ways of rolling out vaccine. If you don't understand what people are really doing and how they're using it, it's not going to work as you expected. So you said do the detective work early. This is part of the detective work. It's not just where the virus is, it's how do people react to the things that we're doing.
Thank you, John. And everybody, John was quoted in the UK Sunday Express on Sunday about honeycomb working. It was quite a nice piece. A journalist who we know called Justin Stoneman got hold of John and started talking to him, which is really good news. And we also got Mike Sandys, Director of Public Health from Leicestershire, who we've had on a couple of our briefings, gave a really nice set of comments in as well. So thank you, John, for your leadership on that. And you never know what's going to take hold. Anybody else? Catherine, do you want to turn on your mic or not? It's up to you. I want to offer you.
No, I think, sure. The thing that I worry most about right now, I mean, I'm with Karen on this, is the travel in the US. Fortunately, all my family that I'm going to be with are all here, but
Yeah.
I do think we're going to need to watch. I'd be very keen to see what happens on December, say, 15th or so. And what will be even more interesting is whether or not there's any opportunity to learn from that for Christmas, since we do have, it's almost a test case in the US with Thanksgiving.
Okay, that's very important. Rob Tyree, thank you very much indeed. Look, everybody, it's been, as always, beautiful. I think I get such a lot out of this. You need to know that. It's part of my own energy. There are so many things that we're involved in at the moment where the kind of observations you are providing are the kind of observations that will shape the future of systems leadership. With that, I'm going to say bye-bye. Have a good rest of the day, and we will be connecting again if you want on Friday morning. To each one of you, big love and hugs. Thank you. Bye-bye from us all. Bye. Polly.
Hello.
That one. Can we get his picture up? Oh, let's just kind of get it.
He's got his dinosaur suit on.
Yeah, nice of you to join, Polly.
I agree with Chris. What a dynamic session.
Yeah. It was very dynamic.
Covered so much.
How's Isaac doing today in his hoodie?
He's very well. What have you got there, buddy?